Hello everyone, welcome to HIM 130. In this lecture, I want to go over the definitions manual with you, the MSDRG definition manual. The first thing I want to point out to you is this is available on the cms.gov website. You'll notice that we're looking at version 38. Every year when the system is updated, this version changes, so you'll always want to make sure that you're working with the most current version. This is a great resource. I think it's underused many times. I'm not sure many people that work in coding understand the content of it. So I wanted to make you aware of it, show you where it was. Now, this is the index, and I'm not going to go over every single item in this index. I do want to point out to you that Appendix A is a list of MSDRGs, so you can actually go to this particular index and see all of the DRGs that are active. Appendix B actually lists every single diagnosis code and tells you what MDC and what DRG range is assigned for that particular diagnosis code if it's the principal diagnosis code. There is a complication comorbidity exclusion list. This is discussed in your textbook. The discussion of the inpatient prospective payment system begins on page 73. And on page 75, it talks about severity of illness. It talks about what a complication is, what a comorbidity is. It talks about a major complication and comorbidity. Those are important because they impact reimbursement. When we code, we aren't necessarily coding for reimbursement, but we have to be very aware of the impact that coding has on reimbursement. We have to understand that if we if we don't code a diagnosis that's a complication or a major complication, a CC or an MCC, that it could impact or adversely impact reimbursement. Same thing, there are some procedures that are designated as OR procedures that impact the DRG in the prospective payment system. So that's one of the reasons that coding accurately and completely is so critical. So there are some diagnosis codes that when they're combined with a CC or an MCC do not impact reimbursement. Now, the other thing that I want to show you is there is a list here of diagnoses that are defined as complications or comorbidities, and there are way too many on this list for us to memorize or to learn. We need to be aware that they're here when we're using 3M and we assign a code that's a complication or a comorbidity in the grouper. The grouper does identify that for us, and you'll be watching a lecture that demonstrates using the grouper, and you will see that. You also have a list of diagnoses that are identified as major complications or comorbidities. And then we have the hospital-acquired conditions list, and HACs are discussed in this chapter. And one of the most important things to understand about hospital-acquired conditions is that your book doesn't give you an entire list of all the codes that are included in those, I think it's 14 categories now. But this is the complete list of codes that falls into that HAC list. Now, if a patient has one of these hospital-acquired conditions, but they also have another condition that is a CC or an MCC and impacts that DRG, the presence of this particular HAC code will not negatively impact the DRG, and that is discussed on page 86 and 87 in your textbook. And I'm going to tell you that I think this chapter 5 in the textbook is a great chapter. If I were you, I would keep this book. So far, I am really impressed with this book, and this is the first year that we have used this. We've used this book for a number of years. This revision is by far the best. So then obviously we have the pre-MDCs, and these are in your textbook. They are conditions that if the patient has this type of surgery, it doesn't matter what the diagnoses are, what the principal diagnosis is. It's going to group to a pre-MDC. And then, of course, we have each of the MDCs. And when we look at these major diagnostic categories in the definitions manual, then we will be able to determine which DRGs fall into this particular MDG. And you just have to go, one step deeper in to look at the different codes that fall within each of these DRGs. So I wanted to make you aware of this tool. It's an excellent tool. I strongly suggest that you find it at the cms.gov website, and that it's a tool that you're familiar with, so that if you are working with coding and reimbursement, you have this knowledge. You'd be surprised how many people working in coding and reimbursement don't really use this manual. They don't know what's in this manual, and I think it's very important to understand that. Quick lecture. Hope you found it helpful.